Turning challenges into opportunities. Advancing health for billions in WHO Southeast Asia region. WHO Southeast Asia region is home to nearly 2 billion people living in 11 countries: Bangladesh, Bhutan, DPR Korea, India, Indonesia, Maldives, Myanmar, Nepal, Sri Lanka, Thailand and Timor-Leste. A region known for its challenges of being prone to natural disasters, densely populated areas and disproportionately high burden of diseases predominantly due to socio-economic and environmental factors. And a region which, despite challenges, has been making progress and achieving milestones and targets around the 8 flagship priority programs identified by Regional Director Dr. Poonam Khetrapal Singh in 2014. The COVID-19 pandemic tested the region's investments in health. Its concerted and focused efforts around the flagship priority programs, including its preparedness to respond to COVID-19, a public health emergency of an unprecedented scale. During the pandemic, member countries demonstrated how challenges can be turned into learnings and opportunities to sustain, accelerate and innovate to ensure health for billions. The vision of Regional Director Dr. Poonam Khetrapal Singh. Globally, no country was prepared enough to respond to a public health emergency of such a scale. For WHO Southeast Asia region, COVID-19 pandemic tested the tools and systems put in place as part of the region's flagship to fortify emergency risk management. Outside of China, Thailand was the first to identify a COVID-19 case in a traveller, with timely enhanced surveillance at all ports of entry. Over the years, WHO had been supporting countries implement International Health Regulation 2005, building capacities and strengthening them with periodic assessments. However, the COVID-19 pandemic required rapid scale-up of response measures, and countries ramped up their capacities while also responding to the virus about which not much was known. The region accelerated strengthening of laboratory capacities from just 5 laboratories to test for COVID-19 virus at the start of the pandemic. Today, the region has over 5,000 laboratories performing RT-PCR tests. Rapid diagnostic tests increased access to testing at national and sub-national levels. 8 of the 11 countries in the region have laboratories conducting genome sequencing. 2 more countries are in the process of setting up in-country genome sequencing capacities. Maldives established and rapidly accelerated its laboratory capacity to cover all atolls. Timor-Leste, which had limited critical care facilities at the start of the COVID-19 pandemic, rapidly scaled up its healthcare system, building capacities for surveillance, critical care, infection prevention and control and case management. Though the challenge was humongous, the scale at which countries accelerated and innovated for preparing health systems to respond to the pandemic was impressive. In the true spirit of health for all, with a focus on the most vulnerable, Bangladesh expanded COVID-19 services to the Rohingya refugees in Cox's Bazar. Thailand conducted special awareness drives for migrant population in multiple languages, in addition to screening and vaccinating them against COVID-19. Innovations using digital technology marked the pandemic response in most member states, with apps used for creating awareness, tracking and identifying people with symptoms, and facilitating COVID-19 vaccination. The world witnessed an unprecedented, accelerated pace of research and production of life-saving COVID-19 vaccines, with the region making an invaluable contribution. Vaccine manufacturers in the region accelerated production to make billions of doses of vaccines available for the region and beyond. So far, over 3 billion doses of COVID-19 vaccines have been administered in the region, with India alone accounting for over 2 billion doses. Bhutan rolled out one of the fastest COVID-19 vaccination drive, administering the first dose to all eligible people across the country in less than 2 weeks. Thailand embedded mobile vaccination teams into home care outbreak investigations teams to offer COVID-19 vaccines at home to the vulnerable population, the elderly and bedridden people. The region's own unique funding mechanism for emergency response, the Southeast Asia Regional Health Emergency Fund or CRF, established in 2008 to fund response with its scope expanded in 2016 to fund preparedness, was utilized by 3 countries during COVID-19 pandemic. Till date, CRF has released $6.77 million to fund 43 emergencies in 10 countries. The COVID-19 pandemic put the spotlight on the critical interplay between strong health systems and health security, which was stressed in the Delhi Declaration on Emergency Preparedness in the Southeast Asia region, adopted by all member states in 2019, and a ministerial declaration in 2021 to strengthen health system resilience to ensure health security and achieve universal health coverage and sustainable development goals for health. These were among the many resolutions and declarations adopted since 2014 for strengthening emergency response capacity in the region. As the pandemic evolved, the regional director held meetings with experts and member states on the lessons learned from COVID-19 pandemic. These lessons are now being used for developing the region's new roadmap for health security, to enhance the capacity of member states to respond to public health emergencies of unprecedented scale, such as the ongoing pandemic. Though pandemic response predominated healthcare and delivery, member states' commitment to the regional flagships was evident from innovative approaches and concerted actions around these programs. Countries demonstrated that routine immunization can be maintained or scaled up along with COVID-19 vaccination. Bangladesh tracked availability of vaccinators and vaccines using digital technology to overcome constraints during lockdowns and ensure uninterrupted routine immunization services. Nepal introduced typhoid vaccine in the country's childhood immunization schedule. India, Indonesia, Maldives and Nepal rolled out catch-up and mass vaccination campaigns for children, including for measles and rubella, another flagship priority program. Efforts for elimination of neglected tropical diseases, NTDs, another regional flagship, revived early in most countries. Preventive chemotherapy against NTDs reached 462 million people in the region by 2020 end. Bangladesh implemented Transmission Assessment Survey (TAS) to be eligible for validation of elimination of lymphatic filariasis. Timor-Leste, pre-TAS, and Indonesia introduced triple drug IDA in selected districts. To ensure continuity in care while ensuring safe distance, health workers in one of India's eastern state gave out medicines for NTDs in bowls. The cure in a bowl approach was later adopted by several states. With determined efforts to address tuberculosis, a flagship priority, Thailand transitioned out of the list of countries with high multi-drug resistant tuberculosis or MDR-TB, rifampicin resistant TB, RR-TB burden in 2021. Bhutan ensured screening for TB at flu clinics along with COVID-19, not to miss out on the preventable yet killer disease. As countries focused on ensuring revival of essential services, Nepal launched its first teleconsultation center at Bir Hospital to cater to people in rural areas. Sri Lanka and Thailand used postal system to deliver medicines for non-communicable diseases. Countries changed policies to allow patients take home 3 months' supply of HIV medicines to ensure people with chronic ailments did not miss out on their daily medication due to pandemic restrictions. WHO Southeast Asia region launched the first ever app to help people give up use of tobacco, a major cause for non-communicable diseases. Amidst the many more accelerated action and innovations, the region also continues to sustain its achievements. The region continues to be polio-free and retains its status of maternal and neonatal tetanus elimination. Maldives and Sri Lanka continue to be malaria-free. India, yaws-free. Nepal, trachoma-free. Thailand, Maldives and Sri Lanka sustain elimination of mother-to-child transmission of HIV and syphilis. Maldives, Sri Lanka and Thailand, elimination of lymphatic filariasis. Bangladesh, Bhutan, Nepal and Thailand maintain hepatitis B control. Bhutan, DPR Korea, Maldives, Sri Lanka, Timor-Leste sustain elimination of endemic measles transmission. And Maldives and Sri Lanka, elimination of endemic rubella transmission. Bhutan and Timor-Leste continue to be rubella-free for over 12 months and are awaiting verification. During the pandemic, Maldives and Sri Lanka were certified for rubella elimination and Myanmar for trachoma elimination, sustaining its support to member states in these challenging times. WHO accelerated efforts and adopted innovative approaches to work with member states and deliver on its mandate. Tons of essential medical supplies worth $20 million was brought in quickly to support member states respond to the pandemic. 355 virtual meetings, trainings, expert consultations, reviews and briefings were held. The regional director addressed over 100 of these virtual meetings. With a country-focused approach, the region allocated 83% of its budget to member states during 2020-2021 biennium, a jump from 79% in the previous biennium. WHO remains committed to work with member states across the WHO Southeast Asia region to sustain, innovate and accelerate efforts to ensure health for billions, critical to achieving the Sustainable Development Goals for health and other global targets.